How does lung cancer metastasize through new blood vessels? Imagine a small tumor in the lung that starts to grow and send out signals to the body. One of the key ways it spreads is through a process called angiogenesis, or the formation of new blood vessels. This process is vital for the tumor because it needs oxygen and nutrients to grow and survive. The tumor releases special molecules, like vascular endothelial growth factor, or VEGF, which tell nearby blood vessels to sprout new branches. These new vessels grow into the tumor, creating a network that supplies it with what it needs. As the tumor develops more blood vessels, it becomes better at growing and invading nearby tissues. But these new vessels also act as pathways for cancer cells to escape. Cancer cells can break away from the primary tumor and enter these blood vessels, especially the leaky, abnormal ones that form in tumors. Once inside the blood vessels, these cells can travel through the bloodstream to distant parts of the body. Common sites for lung cancer to spread include the liver, brain, bones, and adrenal glands. When cancer cells settle in these organs, they can form new tumors, a process called metastasis. This spread depends heavily on the growth factors involved in blood vessel formation. Besides VEGF, other molecules like fibroblast growth factor and epidermal growth factor also promote the growth of new blood vessels. These factors encourage the cells lining the blood vessels, called endothelial cells, to multiply and migrate, helping to build new pathways for both blood flow and cancer cell escape. The blood vessels formed in tumors are often abnormal. They tend to be leaky and poorly structured. This makes it easier for cancer cells to slip into the bloodstream. The process of angiogenesis not only supports tumor growth but also creates an environment that helps cancer invade other tissues and resist some treatments. Understanding how lung cancer uses blood vessels to spread is crucial for staging the disease and developing therapies that target angiogenesis. Such treatments aim to block blood vessel formation, potentially slowing or stopping the spread of cancer. Always remember, treatment options should be discussed with healthcare professionals, as each case is unique and requires personalized care.